So we are going to perform transnasal oesophagoscopy over a dummy. Ideally, in case of transnasal oesophagoscopy, first the patient should be explained about the procedure. The patient should sit in the chair with an erect position. Patient may be supported from behind if needed. Decongestant nasal drop and anesthetic lidocaine spray should be used in the nostril. For the anesthesia of the oropharynx, patient may gargle with 5 cc of viscous lidocaine. To anesthetize the vocal cord, lidocaine spray can be sprayed into the oropharynx while the patient inspires deeply. First, orient yourself with the movement of the scope tip in conjunction with your hand button movement. So I am first inserting the scope through the right nostril, and I can see here there is DNS. So I cannot negotiate my scope on this side, so I am withdrawing it, and let's try to insert it through the left nostril. On this side, the space is much wider. Then I am advancing the scope along the floor of the nose. Then when I am at the nasopharynx, the scope is directed downward. Now we can have a view of the larynx. Here we can examine the larynx, the piriform sinus. Then we have to advance it into the hypopharynx through the postcriquate region. This is the most difficult portion of the procedure. This is the arytenoid cartilage. This is the postcriquate region. This is the posterior pharyngeal wall. Place the tip of the esophagoscope onto the postcriquate region and ask the patient to swallow, then gently advance the scope. Now I am advancing the scope. Do not advance the scope if the lumen of the esophagus is not seen. Visualization of the lumen may require small amounts of insufflated air. We have to advance it through the gastroesophageal junction into the stomach. If the scope is of appropriate size and with good function, then it should be retroflexed to observe the esophageal hiatus from below, which was not possible in this case. So return the esophagoscope to normal position and evaluate the mucosa on exit. Biopsy can be taken from any suspicious lesion. Also, foreign body can be removed with the help of foreign body forceps. Thanks for watching. Goodbye.